Elon Musk loses the race to sew implants into the brain. A critically paralyzed man in New York underwent quite simple surgery this summer and woke up with a superpower. He is now capable of controlling his mobile phone with his mind, to send messages with his thoughts, thanks to a small stent-like implant in his brain that elucidates brainwaves and translates them into mouse clicks, swipes, and emails. The man was the first to undergo such an implant in America, marking a watershed moment in the evolution of brain-computer interface, BCI, a much hyped but slowly progressing field that aims to eventually merge man with machine. Popular Elon Musk has cautioned that we must all one day turn ourselves into cyborgs through brain implants in order to secure the future of humanity relative to AI. He has been working on this issue since 2016, when he introduced his startup, Neuralink. Yet after 6 years and $360 million in funding from the world's wealthiest man, as well as the likes of Google, Neuralink doesn't have enough to show. A target of starting trials of its own device in 2020 has long since passed, and Meta, the parent of Facebook, last year chucked a years-long attempt to develop the technology. The tech moguls were beaten by Tom Oxley, 41, an Australian doctor and creator of New York startup Synchron. This year, his company became the first to obtain an Investigational Device Exemption of the U.S. Food and Drug Administration, FDA, for a perpetually implanted digital brain device. Elon Musk's startup has not yet accessed approval from the U.S. Federal Drug Administration to implant this technology in humans. However, Neuralink's competitor, Synchron, has implanted its very first device in the brain of an American patient, in this case, one with ALS, a neurodegenerative disease that has impacted the patient's capability to move and speak, according to reports. Synchron has already embedded this device in 4 other patients in Australia. According to Bloomberg, these patients have no after effects, and the device has enabled them to send messages through WhatsApp and acquire things online. As Synchron had already received FDA approval in July 2021, it'll be starting a human trial of its device to be implanted into the brains of 6 patients. He surpassed Musk and Mark Zuckerberg by deploying a distinctive approach. Neuralink has created a robot that drills a hole in the skull and then sews thousands of microscopic polymer threads into the brain. The process is filled with risks, including inflammation of brain tissue. Synchron enters through the jugular, then leads its stent-like device through the blood vessels to the brain. From there, it shoots signals to a device implanted in the chest that transmits data through Bluetooth to a mobile phone or computer. The process can be occurred by Synchron's electrode device implanting into the brain without cutting into the patient's skull or impairing its tissues. A doctor forms an incision in the patient's neck, from where the device is embedded with the help of a catheter into the blood vessel within the motor cortex, an area associated with the planning, control, and execution of voluntary movements. When an individual wants to, say, type a letter or swipe their finger right, parts of the brain illuminate. Synchron's system comprehends those signs and translates them into actions. The initial goal is to assist the critically disabled use their digital devices, enabling them to surf the web, read the newspaper, or interact with their loved ones. Reconstructing such a connection can prove a lifeline. Paralysis is untreatable, and BCI is going to be an incredible, life-changing technology, Oxley stated. The company is depending on a 2015 breakthrough in stroke treatment, in which it was manifested that mechanically pulling a blood clot out of the brain via the blood vessels could intensely improve outcomes. There are now hundreds of doctors trained to carry out such neurointervention procedures, which are very related to what Synchron's implants necessitates. Open brain surgery continues to be the domain of a small number of specialists. Do I think this is a moment in history? I had the thought when we implanted the first patient back in 2019 in Australia, Oxley said. When he woke up and I saw the technology in his brain and we saw the data from his brain streaming out on the system, it did feel to me like we're looking at something new. Synchron is not the first down this road. Cyberkinetics Neurotechnology, which also sought to use a brain implant to control devices, was launched 20 years ago based on breakthrough research from Brown University's John Donohue. It was not a success. Oxley aims for Synchron's device to be the first implant that can be left permanently in the brain. In the next 20 or 30 years to 2050, this is going to become a very common technology that helps you engage in the metaverse, he anticipated. Last year, Musk hoarded headlines with a stunt showing a monkey playing a video game with his mind. Yet advancement has been slow. Thwarted, Musk reportedly got into touch with Oxley to discuss a possible investment. Synchron refused to comment, and this US human trial is a first for Synchron's device. It's not the foremost in its field. The Utah array, a microelectrode array technology comprising of a tiny silicone square with 100 needles inserted into the brain when embedded, has been the standard for transmitting electrical signals from the brain to a computer since its advancement in 1992 by researchers at the University of Utah. Until last year, it was the sole FDA-approved brain-computer interface, and it has produced critical results, including enabling paraplegics to control robotic arms.